And of course, and they talk about the foods such as broccoli, I believe, and cabbage and so on. But otherwise than that, she has always said to me, and I've also read up on it, that you can't pass your gas if you don't eat well and you have gas. That cannot be transferred to the baby. And a lot of people you hear telling you that, oh, you didn't eat and that's why the child have gas, and etc., etc. Something that I didn't ask you and I want to ask you now, what causes the baby to have colic, which is a form of gas?
Yes, sometimes it comes from the milk cell. Sometimes it comes from the milk cell that the baby drink. And you know that the 7 days, when the baby born, the 7 days, the baby have to adapt his or herself with around here in the world. And everything have to start to work. The intestine have to start to work because they was not working in mommy belly. Everything was quiet. Only a small blood circulation was working. And when the baby come out, it have to start one time. And that's 7 days. That's the way we always say we have to hold on 7 days to see if the baby, everything is okay. That 7 days, the baby will adopt outside the belly to live here on the world. And that is one of the most time in that 7 days, the people complain, the mother complain that the baby have gas. And you have to feed the baby on time.
That's
if
important.
you don't eat on time, you get gas too.
Right.
If the baby, because your stomach come empty, and when it is empty, gas is fully in, and then you get it too.
The same nail color day after day.
Not me.
New Revlon Top Speed Nail Enamel. Cool color with a built-in top coat that sets in just 60 seconds.
With Revlon, you can change your mind again and again and again.
New Revlon Top Speed Nail Enamel.
Are you looking for that prescription that the doctor just gave to you and you can't find it at no other pharmacy? Well, the Orange Grove Pharmacy is where you should be. Orange Grove Pharmacy, we carry a wide range of American and European prescriptions and drugstore items. We also do personal care products. We offer friendly services and 24 hours emergency delivery. Charges may apply. We're open Monday to Friday 8 a.m. to 6:30 p.m., Saturdays 9 to 1 p.m. Orange Grove Pharmacy, supporting a healthy lifestyle.
Lasagna, a torture test for the best non-stick surface. The Scotch-Brite no-scratch multi-purpose sponge with its unique cellulose weave whisks grime away, leaving expensive cookware scratch-free and spotless. Scotch-Brite, smart, simple and clean.
Nurse Younger, tell me, in your experience here on the island, would you say that women are more in favor of breastfeeding, or are they more reluctant? What have been your experience where that is concerned over the past years?
The most of them, you have to fight a lot with them to continue to give the breastfeeding. They start with the breastfeeding, maybe they want to do it only 2 months so. They cover only 2 months and then they want to stop. And I find that they have to continue longer with the breastfeeding. And I find that the government have to give the woman that got the baby like 6 months to stay home. Now they have 3 months. Now I find that they have to be 6 months. And I find too that when the baby comes, that there have to be a space that this mommy can choose that she can work like 3 days of half days just for concern of that baby.
Okay. So do you think that plays a role in a woman stopping with the breastfeeding earlier because they don't have the time?
The most of them will stop because they have to go work. But the other thing that we explain them that if you have a fridge around there, you can go and you can pump the milk out, put it in the bottle, and so. Some of those lady, they give the breastfeeding in the morning hour, and in the night hour when they reach home, then you know that they want to do it, but there is no space that they can do it because they have to work. They get like 6 weeks after they get the baby. They get 4 before, and then 8 after, of 6 before, 6 after. Then you have to go work. If you don't go work, you lose your work, and things is tight now.
Right, okay. So would you say then that more awareness should be brought to the entire community concerning the importance of breast milk? Breastfeeding. And do you have any recommendations for that? How can we make the importance of breastfeeding, how can we bring that across to the community in forms of information to the public?
I think we have to involve the family in that too, the whole family. If you live in a house with, if it is only you and your husband, I think the husband have to be involved in, that the husband can guide the mommy, that the mommy can get the support at home to do it, because you can give a lot of information, but you are not 24 hours with that lady, to guide a lady. It's the people that live with the lady, they have to be aware what happened with that lady, how the lady feel, how that mommy feel, what they have to help the mommy with, that the mommy can give the baby breastfeeding.
Okay, but in terms of programs, radio programs, TV programs that are not necessarily programs, but maybe 1 minute or 3 minute spots on the television that actually recommend breastfeeding. Do you think that is needed in the community to stimulate people into to educate them about the importance of breastfeeding?
I think that we have to continue with that, because I know that they have a group organization from breastfeeding by the hospital itself, and every year they spread out a lot of information and so. But I think it have to be continued, have to be on the TV and so, and that every minute it can pass, that the people can see, and they can not only for the pregnant woman, but for the rest of the family too. It's more important, because sometimes we think, oh, you have to breastfeed your baby, go ahead, go breastfeed. But the support that this lady needs is very important. Maybe make a little bit warm milk for her before 5 minutes before she breastfeed. Take some warm cloth that you can put on the breast before she breastfeed. Those things is very important. Sometimes we throw that in mommy lap and daddy don't see that, the family, other family don't see that, then you stay there only with your problem. This problem is the whole family problem. It's not only the mommy.
Right.
Educate the child is the family problem. It's not only mommy, it's daddy and mommy together.
Right, and I believe that the positive, the rewards that you can get and that you see with your child from breastfeeding is 100%, because it not only creates a bond between the mother and the child, but it creates a very intelligent child as well.
Exactly.
You know, and I mean, studies have shown that the more you breastfeed, it stimulates the brain of the baby and helps them to grow better in all aspects. So I do hope that you know, more awareness can be brought to the community concerning breastfeeding. Postpartum depression, that is a word that I've heard used a lot of times, and in the Caribbean, you know, I don't think that we pay much attention to it, and maybe women are going through it, but they don't realize it because it's not a word that is commonly used in the Caribbean. What is postpartum depression?
Postpartum depression is when you have a lot of stress, then you feel that the person becomes sick. It can be before you get the baby, and it can be after. Postpartum is after you get the baby, but it can be before you get the baby too. A lot of stress and so, and then you see that the patient start to do things that is not normal. Sometimes they talk things that is normal. Then you have to take care of those patients, because if you don't take care of those patients early, then it can be that those patients lose the mind completely, and later when they get the baby, maybe they see the baby there, they tell you, this is not my baby, they don't want to feed the baby, they changed completely. That's the way. It's very important that you get, if you plan into pregnant, I always say, if you plan into pregnant, you have to plan into pregnant because a baby is not like you go to the grocery, you buy a baby. It's very important. You have to plan to pregnant. And when you plan to prepare, both couple have to be responsibility of the pregnancy, because if anything happen with mommy, daddy have to take care of the baby. And if everything happen with daddy, mommy have to be there with that child. It's very important that you're planning to be pregnant.
So how can a woman avoid postpartum depression, or is it something that has to do with, is it hormonal? What can cause postpartum depression?
It can cause, because it's the hormone, it can cause via the hormone, but the stress too. That's the way when a pregnant woman have to be happy. You have to be happy. This you have to get it in-house. This you have to get to find your partner. Your partner have to be concerned that your partner have to take care of you, to make that you can go through this pregnancy with less stress. That's the way I say too, that you have to plan it for when you plan it for the pregnancy. I know that you go to have a happy pregnancy because you plan it for it, you expect the baby, you live with your baby, you live with your pregnancy. But if you don't plan it for it, then everything that come on you is not good for you, and that can put you in depression too.
How can you in your profession as a midwife help someone who is experiencing postpartum depression?
Depends how is the level of the depression, because otherwise I have to send it to a specialist, because sometimes it is so that those patients, those lady have to get some medication to help them. And the most things is the family have to be there with them. That is the most important things.
Right, and you talk a lot about family. So what would be your recommendations for fathers, expectant fathers, once they become fathers as well, and as to how to help their spouse after pregnancy?
I always say, when a baby comes, you start with the family. And when you start with the family, you have to be responsible of the family, both daddy and mommy. If you don't want to get a baby, there is so many things that you can use that you don't pregnant. If mommy don't want to get a baby from the spouse, then mommy have to use something. If daddy don't want to get a baby from mommy, then daddy have to use daddy condom. So then when the pregnancy comes, when the person is pregnant, that means you start with the family. And start with the family, that means both have to be there for that child. That child is innocent. That child don't ask nobody to come to this world. You have to carry responsibility. You both decide to bring this child to this world, and you both have to carry responsibility of this child.
Well, Nurse Yanga, I would like to thank you for having been a special guest on A Better Place. Today we discussed quite a number of topics pertaining to delivery and postpartum, and I would like to thank you once again for sharing all of your knowledge that you have experienced throughout your years as a midwife here on St. Martin.
Thank you to invite me.
And to you, the viewing audience, I would like to thank you for taking time out of your busy schedule to be a part of A Better Place.